Hello and welcome to South First. I'm Sumit Jha. Winter months often bring a surge in respiratory illness among children, particularly in urban areas where pollution and fog are quite prevalent. The drop in temperature, coupled with increased in exposure to airborne pollutants, make young children more vulnerable to conditions like asthma, wheezing, and infections caused by viruses and bacteria. These challenges not only affect a child's health but also raises concern for parents who strive to manage recurring issues effectively while balancing preventive care. To shed light on these concerns, we have Dr. P. Suresh Kumar, lead consultant in pediatric critical care and pediatrics at Yashoda Hospital in Hyderabad. Welcome, Dr. Suresh. Welcome to South First.
Hi. Hello.
Okay, so my first question, there is a popular perception that respiratory issues in children tend to worsen during the winter months, especially in areas with high levels of fog and pollution. Is that so? If yes, why? Would you like to answer that first?
Yeah. Like you said, respiratory infections are quite high in the winter because of the weather, and the viruses tend to remain much more stable as compared to that in the summer, number one. And infections are pretty high during this season for various reasons. One, because of the proximity to each other in the school amongst the children, and gatherings that occur in malls or any other areas, and the viruses tend to remain potent and alive for longer duration in the winter. That's one of the common reasons why we tend to see a rise in respiratory tract infections, especially the viral ones during this season.
Okay. So, what are the most common respiratory infection you observe in children during the winter season? Is it RSV or influenza, or what kind of infection are these?
Yeah, there are quite a lot of viruses that occur during this season, but one of the commonest one which we see is influenza. Amongst influenza, we have got influenza A, influenza B, and H1N1, which is popularly called as swine flu. A lot of these infections are there. In addition, we see amongst the preterm babies, that is those babies who are born very early and with a low birth weight, we see an increase in RSV, that is respiratory syncytial virus. This can be a simple or a subtle one, or in these babies who are born pretty preterm and low birth weight, it can be a life threatening one. The other viruses like rhinovirus, which is always there, which can cause simple common cold, and other viruses like enterovirus, parainfluenza viruses. These viruses can cause simple upper respiratory tract infection, or it can also cause the infection of the lungs, so what we call as bronchiolitis, and then subsequently it can lead on to respiratory failure, that is the lungs tend to not function well, requiring supplemental oxygen or ventilatory support.
So,
These viruses are seen throughout the year, but we see a rise in these numbers predominantly during the monsoon and winter.
So, like winter also see the pollution, rise in pollution. So, does pollution also exacerbate these conditions, these viruses during this season? Is there any role of pollution in it?
Obviously, it adds on to the problem because it might not increase the incidence of viral infections as such, but because the lungs are already affected with these viral infections, in addition, when we have this pollution, it tends to cause damage to the lungs. For example, a child who is an asthmatic tend to have difficulty in breathing because of narrowing of airways.
Yeah.
So, as such, the drop in temperatures like coldness in the weather can cause more bronchospasm or narrowing of the airways, because of which the child tends to breathe with difficulty. And when we have super added viral infections, it tends to cause damage to the lungs and smaller parts of the, so it becomes difficult for the lungs to expand. And when we have this pollution, it causes hyperreactivity to the airways, which causes bronchospasm, that is narrowing of the airways. So the child will not be able to clear out the viral infections quickly. But as such, pollution increasing the viral infections might not happen, but pollution causing damage to the lungs definitely it happens, and it can be very severe in children.
Okay. So you mentioned asthma. Is there any like we also see that like the change in temperature also tends to cause these allergic reactions, allergic rhinitis as such. So is there like is it because of the pollution as well as because of the winter? What is the reason for that?
Yeah, both of them actually, a drop in temperature as well as the pollution. In addition, the third factor which we tend to miss or not give much importance is these pigeons, because in the south we see a lot of pigeons. These pigeon droppings, pigeon feathers, they can be potent allergenic. In
Okay.
fact, not just asthma, it can worsen lot of conditions like allergy, allergy bronchitis, allergic rhinitis, asthma, and because of prolonged exposure to all these factors, it can cause a disease called interstitial lung disease, which can be irreversible lung damage. That is, once the lung is damaged, it's hard to bring it back to normalcy. So we are seeing a rise in diseases related to this. All the factors which we discuss, like pollution, drop in temperature, pigeons, pigeon droppings, all of them matter to child's lungs.
Like many parents are hesitant to use inhalers for children prone to wheezing or frequent infection, and it also like for asthma as well. So, what would you say to reassure them that about the safety and effectiveness of inhalers for this asthma and wheezing?
Yeah. There are a lot of myths about inhalers,
Yeah.
but when you actually know what it causes, and when you realize that it does not cause damage, parents tend to get convinced. Again, let me put it very simple. When you really need to use inhalers or nebulizers, only then you should use, and you should not use by buying it over the counter.
Okay.
You should always use this only based on the doctor's advice, and when it's required, do not hesitate. For an I will just tell a simple example. For a child who has wheezing, when we give this cough syrup with the bronchodilator, the amount of medicine which we give for 5 days uh, in the oral syrup is equal to 3 months of the medicine dosage what we give through inhalers. Now you can imagine, we are definitely not giving more dose, and also the drug which we are giving through inhaler is directly going to the lungs where there is a problem. So you do not have systemic side effects, like the drug is not absorbed and then spread into the blood and then giving side effects. We will not see with inhalers. Does not cause any dependency, because a lot of parents think that child might get addicted or might get used to this inhaler. It
Mhm.
does not happen. And next, make sure that the child rinses the mouth after they use this preventive medication as inhaler, because sometimes the medicine can get deposited in the oral cavity or the mouth. That can cause problems. So, after using these inhalers, they should always rinse. Again, in inhalers, we have got another one is relievers. As the name suggests, the preventer is used to prevent the number of episodes of this asthma or exacerbations, whereas reliever is the medication which is used to relieve the symptoms as and when the child actually has symptoms.
Okay. So we
So
also.
when they are used under supervision and guidance, they are very, very safe.
Yeah. Sir, we also see the like with increase in pollution and all in around that with change in the season as well, we see repeated respiratory infections in children are a very common concern. What underlying factors might be causing this, and how can they be addressed? The repeated respiratory infection which is causing in children's.
Okay. We'll start with prevention of these recurrent respiratory
Yes.
infections.
Okay.
Simple measures like frequent hand washing, masking up the nose and mouth, and cough etiquette. When somebody is coughing, it is quite commonly we see that they just cough in the air or they cough in their palms. Never do that. Cough into their elbow.
Okay.
what we call Dracula cough. When they cough into the palms, without knowing, when you shake hands with the other person, you are spreading the germs into the other person's hands, which can be spread into their lungs. So, frequent hand washing, use of mask, and cough etiquette. Avoid gatherings when you are unwell, or avoid taking your child to a gathering where you think somebody might be unwell. These are the basic precautions. In addition, child should take necessary vaccinations which are available to prevent these recurrent respiratory infections like influenza. We have this influenza vaccine, which the strain of which changes every year. So once a year, this influenza vaccine should be taken for at least children less than 6 years of age, or those children who have other issues like lung issues or heart issue or prematurity or any other health related issue. If we follow these basic precautions, we can avoid recurrent respiratory tract infections. Now, again, there is another injection which has come up, which is specifically to be used under the guidance of the pediatrician only in those which is required. That is RSV,
Yes.
what we talk about RSV, respiratory syncytial virus. Now we have got an antibody for that, which is to be used only specifically in those children who are born preterm, less than 6 months at the onset of monsoon. In those children, we should use this medication, which tends to prevent significant number of hospitalizations, thereby reducing the morbidity and mortality and reducing the financial burden for the family.
Sir, I have this penultimate question. Are there any specific age group that are more vulnerable to respiratory infection during winter? What precaution should parents take over infants, toddlers, or older children?
So in children, again, we classify children into multiple ages. Infants, that is less than 1 year, they tend to get severe infections because they do not have enough immunity. What we call simple respiratory tract infection, we call in children bronchiolitis, that is smaller airways tend to get swollen. The children is school going because in the and the exposure is high. When somebody who is unwell attends the school, they tend to spread to other children who are there in the class. So these are two high risk groups. And again, those children who are born preterm, that is before the completion of 9 months of gestation, or those children who have issues with their heart and lungs. These are the ones who are at high risk of developing recurrent respiratory tract infections.
Sir, last question. Recently, we have seen that parents are also tend to take antibiotics from over the counter and they give to their children. Here, I have this question for you: that what symptoms should parents watch for that indicated respiratory condition may require a medical attention? One, the condition which required a medical attention, and when not to give the antibiotics taken from the OTC.
Percent of these, number one, 90% of these respiratory infections, what we see during winter, are viral. And viral infections do not need antibiotics at any stage,
Okay.
unless there is super added bacterial infection over and above. And when we should seek medical attention, if child's cough is affecting child's breathing, sleeping, feeding, or child is breathing too fast or too shallow, or child is not able to speak a sentence without interruption to his breathing.
Yeah.
These are the conditions which can be very ominous. They should rush to the pediatrician quickly.